Some of the applied aspects related: hypoparathyroidism. It is nothing but decreased secretion of parathyroid hormone, which leads to hypoparathyroidism. Some of the causes are surgical removal of the parathyroid gland, removal of the parathyroid glands during surgical removal of thyroid gland, deficiency of receptor for PTH in target cells. When total serum calcium level is decreased below 6 mg%, it results in hypocalcemic tetany. Simultaneously, serum phosphate is also decreased. The treatment for hypoparathyroidism is administration of 125 dihydrocholecalciferol, and sometimes there can be administration of parathormone, which usually not done. Tetany. Tetany refers to clinical condition resulting from increased neuromuscular excitability. When ECF concentration of calcium falls below normal, neuronal membrane permeability to sodium increases, allowing easy initiation of action potential. Some of the clinical features of tetany are carpopedal spasm, which is also called as obstetric hand. It's a peculiar attitude of hand in tetany. There is a flexion at the wrist and thumb with hyperextension of remaining fingers. There can be laryngeal stridor due to the spasm of laryngeal muscles. There can be visceral manifestations which include intestinal colic, biliary colic, and bronchospasm and profuse sweating. So this is obstetric hand in case of tetany. You can see there will be flexion at the wrist joint, flexion at the metacarpophalangeal joints. There will be ECG changes like ST segment is prolonged with abnormal T waves. Trochiosinase, when occluding the blood supply to the limb by inflation of sphygmomanometer cuff, produces characteristic carpopedal spasm. And Chopstick sign, when the tapping the facial nerve at the angle of jaw, produces ipsilateral contraction of the facial muscle, and this occurs due to the increased excitability of the nerves to the mechanical stimuli. Hyperparathyroidism. It occurs because of the increased secretion of parathyroid hormone. Based on the cause, it is divided into primary and secondary hyperparathyroidism. Primary hyperparathyroidism, where abnormality of the parathyroid causes excess PTH secretion. The cause is maybe a tumor of the parathyroid gland. Here, calcium ion concentration is elevated due to the extreme osteoclastic activity, and phosphate ion concentration is decreased due to the increased renal excretion of the phosphate. Secondary hyperparathyroidism, here high levels of parathyroid hormone occurs as compensation for hypocalcemia. The cause may be vitamin D deficiency or kidney damage. Some of the clinical features of secondary hyperparathyroidism are depression of central and peripheral nervous system, muscle weakness, constipation, abdominal pain, peptic ulcer, depressed relaxation of the heart during diastole. There can be increase in serum alkaline phosphatase levels. The cystic bone disease of hyperparathyroidism is also called as osteotic fibrosa.